Hi everybody, my name is Wes Anderson, the Community Relations Director here at Southern Hancock Schools. We're discussing the blueprint for reentry for 2020-2021. And I'm joined today to my left is Superintendent Dr. Lantrip, and to my far left is our Director of Student Services, Mrs. Katy Eastes. To my right is our Director of Instructional Services and our Safety Director, Miles Hercamp. So we're going to kind of walk through a few points, a few of the high points of the blueprint. We'll encourage all of our families to read it. We'll kind of move in order here through the blueprint, so if you want to kind of pull that open and follow along with us as we talk about this, it'd be a great idea. Also say we'll have the four of us together on Wednesday morning as well on the district's Facebook page, facebook.com/Southern Hancock at 11 a.m. We'll be doing a Facebook Live to answer your questions you may have about the blueprint, so please tune into that. I'll put my email on the screen here, and you can send me some questions if you have them after reading the blueprint. We'll be happy to answer those on Wednesday morning. So as we kind of go in order of what the blueprint says, the first question I want to ask everybody is about the virtual option. And we're going to have two options for students when they come back. They can either attend school in person. We're going to start on August 3rd like we usually would. Our virtual program is going to start at the same time, but those students are going to stay home. So talk a little bit about the importance of that, and then what the structure is going to be.
Sure. So first I want to remind everyone that we open registration on July 6th, and at that point in time you have the choice of choosing a virtual option or what I'm going to call brick and mortar traditional schooling. We sent out a series of surveys in the spring over many things, but mostly about schooling, virtual schooling, and we took those comments from our parents and our students and our staff, all three, and began to really truly read the comments and look at that survey to say what needs to be different for students. And to the virtual program, I'm going to call it, you notice it's called virtual versus e-learning, and I want to make that distinction. E-learning will still be in place for those days, for snow days, inclement weather, or the professional learning days that we have with our staff. And that will remain similar to what we've done in the past. But for the students that a virtual option is the best option for them due to health concerns, then that will look more like a traditional school structure. The students will have 4 core subjects, K-8. They're English, language arts, reading if you're in the elementary school, math, science, and social studies. They will be held to the same attendance standards. They will meet daily with their teacher. They will have homework assignments that day whenever the teacher says that they're due. So it will be very much similar to the traditional school setting. And that is so that if for some reason the children would like to come back to the traditional setting, we will be able to switch easily. Or if we have to be shut down, then all children will move to that virtual setting. It will be taught by a classroom teacher. That students will be assigned to a classroom teacher so that they will be connected with the classroom and a group of students. Again, we want to make sure that children are connected to school, whether it's in the virtual setting or in the brick and mortar setting. We want them to be able to connect with the teacher and other students. We want them to have that sense of community and a level of normalcy even if they are learning at home this year.
So Mrs. Eastes, I'll ask you the question, because one of the things that I've heard the most kind of out around the community is concerns from our families with IEPs or 504s about how moving out of the school building and moving to a virtual program will affect them and what that does for the services that we provide.
Sure. So our charge is always to meet the needs of our students. And so for special education, students with 504s, it's really been business as usual. We have continued, even in our e-learning format, to meet the needs of all students. And so that's meant a lot of hours in that digital platform. And so we had students doing their speech and languages services in sessions online. We've gotten very good at things that we've never done before. And so no matter the platform that a parent decides for their child, we are going to meet the needs of that student. So it's possible that there might be a related service that really does lend itself better to the brick and mortar. And so if your child is doing virtual school, we may ask that you bring them to school for just that period of time. And of course, the case conference committee will make that decision. The other thing that we want to think about, and we have been thinking about in great detail, is our medically fragile students. And so we'll be working very closely with the parents of students who fall into that category, and we may be updating health plans as needed.
So the next thing I want to talk about is pretty controversial topic. It's been the topic of masks and the face coverings, and I want an opportunity to really address the decision we've made and kind of some of the reasoning behind it. And before we talk about that, I'll say this, everything we've done the whole way has been based on guidance from the governor, based on guidance from the Indiana State Department of Health, from the Indiana Department of Education, and from the Hancock County Health Department. So before we get into what the guidelines are, I want to state clearly, this is what their guidelines are. We have followed our health department's guidelines in what we have to do to stay open, which is our goal. We want kids to be safe. We want to be open in that order. So let's talk about the guidelines for face coverings for a minute. And essentially, we're going to recommend them all the time for everyone. There are certain times where they're going to be required for our kids to wear them. Examples would be in our hallways, during passing periods, on our school buses. Essentially, any time when we can't guarantee that they'll be socially distant, we're going to require that the mask goes on for a period of time. So kind of walk me through that decision and how we got here.
Okay, so the guidelines that we've received is that children, or everyone, children and adults, should be wearing masks when social distancing is not available, or we can't do that. Example of that is the bus. We would only be able to get like 5 kids on the bus and maintain a 6-foot social distancing. However, what the guidelines also say is if 2 people wear the mask, the likelihood of cross-contamination or infecting each other is very low. So as long as we put children from the same family in the seats, and we have assigned seats, and both kids or all the kids on the bus have a mask, then that meets that requirement for socially distancing or the mask wearing. So when you think about a school and you think about those areas that children and staff are allowed to congregate, the hallways, the restrooms, those big open spaces, then you begin to see that we can't guarantee social distancing at that time, and children and staff will be required to wear masks at that point in time. There will be times that in the classroom, the most appropriate way to keep everyone safe will be to wear a mask. And I understand that there are people that don't like the idea of wearing a mask. It's not my favorite thing to do either. However, I understand that our goal is to keep everyone safe and that I have to play a part in that. And that part is to wear the mask, to keep others safe. I also know that we want to keep school open. And if we have an outbreak, and an outbreak is 1 to 5 people, then we will be shut down for 1 to 14 days. And we don't want that to happen. So we're asking everyone's support as we go into the school year to wear the masks when they're required and when a teacher tells them to wear it, but also encourage your student to wear a mask all day, with the exception of lunch. And lunch will look very different than what it has in the past because we will maintain social distancing throughout the lunch period because it's hard to wear a mask and eat. So we are asking people to please help us with this. It is important that we keep everyone safe. We lower the possibility of any type of disease or germ being spread, and that will help us keep our schools open.
And Mr. Hercamp, one of the things that you've spent your summer doing is trying to source a significant number of masks. So we've put a mask on the supply list at every grade level. So you're going to need to provide one, but you've been able to source some so that we have those available for students. If the event they don't have a mask, they lose their mask, etc., you have a few of those to provide.
Yes, we've been very fortunate that we've had some donated, but we've also purchased some so that every student will get a mask, and it will also have masks will meet the needs of some of our students so that face shields and what they are working with. We're working with our band and choir at this time to figure out what type of face shields they can use to keep our kids safe. And we've had different groups. We had a couple groups, Hancock County Hospital, Regional Hospital has donated 10,000 masks to us. FEMA gave us like 20,000. Those are more the paper masks, but we're getting cloth masks for all students, face shields, and a multiple different type of masks to meet all of our students' needs.
So let's start talking about day-to-day operations here because there are significant changes to come. And the first thing is, is with our start times. And not a significant change to the high school because of the Block 4 schedule, which we're going to talk about here in a minute. But the rest of the district, K-8, are going to be backed up 5 minutes. They're going to start 5 minutes later at the beginning of the day. One of the main reasons for that is we need time to be able to stagger the release of those buses. And when they pull into the parking lot at our intermediate school, junior high school, elementary schools, even at the high school, they're going to release one at a time. And we're going to make sure that we keep that social distancing possible. So wanted to build a little bit of that extra time in the schedule in terms of the buses. However, there's a lot of other changes too related to that in the car line. And some changes specifically at the elementary level that we know our parents probably are not going to be very happy about, but we think are important to protect the safety of our kids. So let's talk about the car line for a second and what is changing around our buildings at drop-off and pick-up.
Right, so we want to make sure that our children are safe, our staff are safe. And that is our number one priority. We want them to be safe and we don't want to be shut down. So we cannot have people getting out of the car. I know that we have parents that walk their children to school, especially that first day of school. I'm sorry, we can't have you do that. We are not allowing visitors into the building and into the classroom. So you will need to stay in your car. Our elementary principals are working right now on a plan to make sure that they grab your kiddos, and I'm talking about your kindergarten student especially, because we know that that is their first experience in school. We're going to take them and keep them in a place that's safe and get them to their classroom. But we're going to take them from you in the car rider line. So please stay in the car. I know some of you might have walked up to the building to pick up your student after school or to drop them off in the morning, and you're not going into the building, you're just walking them to the building. We're asking you not to do that. Again, it's all about social distancing and trying to make sure that we can keep everyone safe that comes onto our campus. So you will need to stay in the car rider line, which may mean that you need to talk with your employers, because I know how long the car rider lines are on a normal day. This will increase the time, which is also kind of what we're doing with the buildings and the buses, which because of the time it's going to take for everyone to get into the buildings. So please be patient with us. Please follow our recommendations. This is for the safety of your children, the staff, you, if you're out of your car, and all of us, and we want to make sure that we can stay open.
Along those lines, too, some changes to our visitor protocols. And basically, we've always been very welcoming to visitors.
Right.
And parents can come in and eat lunch, and grandparents can come in and eat lunch, or stop by and visit the classroom. And again, the necessity of kind of keeping that school environment self-contained is critical. So, the change where visitors are basically only going to be allowed in our lobby.
Right.
And any business you need to conduct is going to be conducted in the lobby, and that's going to be it. You're going to see plastic, plexiglass, the sneeze guards, so the big plastic screens in front of all of our desks. There's going to be markings on the floor, so you stand 6 feet apart when you come into our building. So, also significant changes there, and I know changes from what has been a really important part of our process for our parents and our grandparents, but an important one to keep students safe by keeping our visitors separated from the kids.
And I know that this is not what any of us want. I'm going to put that out there. We like the fact that our community, our parents are very involved in the schooling of our students. But beginning in August, we need you to follow some different protocols. One of the protocols is if you need to come into the building to talk with an administrator, a teacher, the nurse, the counselor, anyone, you need to make an appointment first. If you need to just drop something by, we're going to ask you to call the school. We're going to arrange for, basically, if you need to drop something off or pick something up, that exchange without you coming into the school if possible. When you come into the school, we're going to ask you a series of questions, just like if you've been to the doctor's office or anywhere lately, about the COVID symptoms. We're also going to ask you about your temperature, because if it's elevated to 99.5 or above, then we're going to not let you come in, unfortunately. And we are going to keep you in the lobby. So if you want to go back to the classroom or have lunch with your child, unfortunately, you're not going to be able to do that starting in August. Hopefully, this is a temporary situation because we know that that is an important part of our school community, and we want to go back to that as soon as possible. But for now, we need you to follow these protocols. Again, we want to keep kids safe, we want to keep staff safe, we want to keep the school open. So you want to come into the building, you need to call ahead. When you get there, you need to ring the doorbell. They will be expecting you. They'll have the questions ready for you. You come in, you'll go up to the office, and there's the lines on the floor, those types of things, just like if you go to CVS right now. And so you have all of that. You will not be able to go eat lunch with the children right now, and you'll not be able to go back to the classroom. Volunteers, we will still have volunteers, but they have to go through a more in-depth process, just like our teachers and our students do, to kind of get back into that realm. But you'll also be required to wear a mask when you enter the school. So wear a mask. Be ready to answer the questions about the COVID symptoms. Ring the doorbell, make an appointment, and know that we're probably not going to let you go back into the building. So please help us do that and help us keep our children safe, our staff safe, and keep us open. That's the goal of this, is to keep us open.
So once we get the kids in the building, I want to talk about kind of the environment in there. Mrs. Eastes, I'm going to put you on the spot here in a minute and ask you a question I didn't prepare you for about SEL,
Okay.
about social emotional learning. So I'm going to ask you about that in a minute. But once we get the kids in, I want to talk a little bit about what that classroom environment is going to be like. And to me, in my opinion, as not a career educator, but thinking back to my days in school before flexible seating, before a lot of these digital tools where you had row of desks, person sits, and everybody's facing the same direction, and the teacher stands at the front. It almost, to me, feels kind of like going back to that in a way. And so talk a little bit about the changes in the classroom, kind of away from that flexible seating that we've gone towards from a safety perspective. So I'll ask you that question first.
So you're right. It does look very traditional, probably more of when I went to school than when you went to school. But one of the ways that we have been told by the Indiana Department of Education, Department of Health, etc., that we can allow children to not always have their mask on in the classroom. There will be times when they will be required to have the mask in the classroom, but there are times when they might not have to have it. Is if all the kids are facing the same direction, and we have distance between the teacher and the student, so that the teachers would be the benefactor, I guess, of all of the germs coming their way, because students would be in rows, all facing the same direction. However, for the elementary kids, we know that sometimes that is kind of hard to stay in your seat and facing forward. It's hard for me as an adult, let alone for a 7-year-old or 8-year-old. So we have purchased partitions that will go on desks and tables that will help keep hopefully the germs more contained to that area. So the other part that you'll see differently is we have sanitizing stations all over the building. We have them in the classrooms. Kids will be expected to sanitize at least when they come into the room and when they leave the room. Of course, we'll work with them on hand washing, making sure they sing the alphabet song or whichever song the teacher chooses is the right song for when they're washing their hands, so that we have that, and they'll be going to the bathroom to wash their hands before they go to lunch. Those types of safeguards. The classroom, we have really, really great teachers, and I will tell you that some of the things that we have to do, they're not, they don't want to do either. They like to have the kids grouped into tables and use the flexible seating. But for the time being, to get school started, we are going to follow those guidelines, which will have kids sitting in seats facing one direction.
So from a health perspective, let's talk about actual physical health here. And I want to touch on the changes in some of our clinic procedures. And the number one question that I get when I'm out is, what happens when a kid gets sick?
Right.
And what are we going to do with a student who is sick, who is symptomatic, who has a fever? What are our protocols to get that student away from the student body and then get them back home safely, while potentially, in the event this child does have COVID-19, to keep them away from as many people as possible?
Sure. So first thing I'm going to ask all parents, we're going to ask you each morning to take your child's temperature and go through that COVID checklist. And we're going to ask you to really and truly do that for us every day. And if your child is not feeling well, and I'm not talking about seasonal allergies, we all have those, I'm talking about they get up and they're complaining that their stomach hurts, their head hurts, they might have a very low-grade fever that you're thinking, oh, they get moving around, they'll be fine. I'm asking you not to send them to school that day, because those two things with that low-grade fever are symptoms of COVID or influenza, to be quite honest. So we're asking you to keep them home. That's the first thing. The second thing that we're going to talk about is there are going to be changes to the clinic procedures. And one of those is that basically if your child is sick, they're sick, and we think that they may have COVID or they're running a fever of any type, I'm going to just go there, we will quarantine them. And they will be quarantined. Each school has an area. It's usually in their clinic. And then the children that are coming for medications, those types of things, will go to a different area in the office to get those. So the clinic will really be for kids that are sick. When we call you, we'll need you to come and pick your child up as soon as possible. Again, make sure when you're filling out the registration form that we have contact information of somebody that can come and get your child when they're sick. We don't want them to be in the clinic all day while they're sick. They don't feel well, they want to be home, and we need them to not be in the clinic as well. So make sure that information is up to date. Little service announcement over here. Sorry, Mr. Anderson,
No,
you did
that's
not
fine.
ask me that. But and the other part of it is many times we give children their medications in the beginning, in the morning, right before school starts, or right before they get on the bus to go home. We're asking that you work with your doctor to see if those medications can be given at home so that there's less kids in that clinic area for so that we don't contaminate if there is somebody sick. The other thing that you're going to see is that many things will be taken care of in the classroom. More things, for example, they're out on the playground, they fall, they get a scraped knee, the teacher will have some antibiotic swabs and a Band-Aid, those types of things. If it's beyond the scraped knee, they will go to the nurse's office still. But some of those things where we would have just sent them to the nurse's office, they might be taken care of in the classroom by the teacher.
Also want to touch on immunizations really quick and our change to our deadline for
Right.
immunizations to be done.
Right, so we've been very lenient on the requirement for immunizations in the past. We've given you until fall break. We don't need somebody with measles coming to school in a situation where there's also other children that might be experiencing something else. It's really for the safety of all kids. So we're asking that all immunizations be up to date before the first day of school. We will exclude your student on the second day of school if one of these things have not been met. They don't have their immunizations up to date, or you don't have an appointment with your doctor to get that, because I know everybody's got to rush out and get those, and doctors are kind of busy right now, trying to catch up from when they were not seeing patients. And the third one would be if there's a waiver on file, and the waiver you would need to talk with our clinic assistants to find out what that entails. But so we need you to have your immunizations up to date, and that's really critical for kindergarten, 6th grade, and seniors. Those are the years that they add new immunization requirements. So those need to be up to date by the first day of school, or we have an appointment card that you can show us, or you have a waiver on file.
So we talked about the physical health, and here's a question that I wanted to ask you. I know a lot of your focus this summer has been on social, emotional health of our students. Obviously, this is a difficult time for everybody, a difficult concept for some of our really young kids to understand, but potentially issues that we're going to see across our student body. So talk about kind of some of your focus with SEL, social emotional learning, throughout this summer, and as we bring our kids back after being gone for basically 6 months here for 2020, 2021.
Right, so when we talk about all of our plans for reentry, so much of it is very intentional and very scheduled, and as we talked, very traditional in the way it looks as far as the classroom setting and things like that. But we know that the relationship between the student and the teacher is so very important, and between students and other students. And so we know that we need social emotional learning now more than ever as adults and as students. And so the Indiana Department of Education has put out a social emotional learning roadmap, and anyone can take a look at that. But we've been working very hard as administrators this summer to really dissect that roadmap in order to best meet the needs of our children. And so we've been working on just different ways that we know we need to be in tune to their needs as we re-enter the school buildings and even that virtual setting. The other thing, at the end of May, all K-8 teachers and many administrators and even a preschool teacher attended a training with us on social emotional learning. It's called Trust-Based Relational Interventions. And we talked so many times about how this was perfect timing for what our students need. And so part of that is some students will be attending nurture groups where they really work through some things that are worrying them right now. So we just have a lot of support in place for students as we re-enter after so many months at home, as you said, Wes.
So last thing I want to talk about today, and again, we'll have more discussions on Wednesday at 11 a.m. during the Facebook Live and the district Facebook page, but last thing we'll talk about is the change of high school to the Block 4 schedule from what we call a modified block, 7-period day, which our parents went through previously. So I'll kind of ask you first about kind of some of the reasons why this happened, and then Mr. Hercamp, I'm going to ask you some questions about this as a longtime high school teacher as well, and administrator. So a big change from 7 periods a day to 4 periods a day. So let's talk about kind of some of the methodology here.
So when you start thinking about the high school, and I come from an elementary background, so I knew that we could put some things into place pretty easily at the elementary level and maintain social distancing because the kids are with a teacher, and that teacher then basically takes them to and from the different places. So that was an easier way fix or to get to where we needed to be to go back to school. But when you think about the high school, 1,200 students in a building that already the hallways are too narrow, and we're under renovation. I mean, it couldn't have happened at a better time, because that will be different as well. And different hallways, parts of the building will be closed down for the renovation. So that means we're going to be crowding more and more kids into a smaller space. So the first question that I asked Mr. Fessler is, how are you going to social distance? Remember, when kids are congregating, they have a better chance of transmitting disease and contracting disease, right? So we want to decrease the times when the kids were in areas where they could actually congregate. So that was part of it. How are you going to maintain social distancing in high school? Then looking at the survey results, again, I read every single comment on those survey results and talked about and processed through it with the administrative team on what does this mean, and with the Teachers Association as well. And it became very clear that 7 periods of class periods a day, when you go to a virtual setting, especially since this will be just like going to school, I mean, it's much more structured than the e-learning, was difficult with the e-learning, which was not as rigorous as what the virtual programming will be. And so that became concerning based upon the comments from the students, staff, and parents. And so how are we going to work on creating a situation where we are not overloading anyone, whether it's the students, the staff, or the teachers, when we may have to go back and forth between this virtual environment and the brick and mortar environment? And how do we make sure that everybody gets what they need when it comes to instruction? We want to make sure that kids are on track to graduate. We want to make sure that they have the core or essential learnings that they need for the next grade level. So how do we do that? And that was basically what I threw on the table to Mr. Fessler and his team. And they came up with a plan on how best to meet that. And that would be where Mr. Hercamp was part of those conversations. Yeah,
so obviously as the Director of Instructional Services, you've kind of got a big hand in that. And I know you were part of a lot of those conversations and decisions with the high school administrators about why the Block 4 was the choice. So run me through some of the benefits, of what the Block 4 is. I know you talked a little bit about that transition between in-person and virtual, but what made the Block 4 such an appealing choice?
Our high school administration looked at multiple different schedules, and this was by far the best one they came up with. The big thing is less passing periods. The way it's set up, you have 4 75-minute classes, And so you have the same classes every day, so that at the end of 9 weeks, you've completed a semester for those 4 classes. And then the start of the second 9 weeks, you are in 4 different classes, and you complete those classes within the 9 weeks also. But the couple of the biggest things is the transition back and forth, less passing periods, but we were also able to put in a homeroom, and as Ms. Eastes talked about earlier, how important that SEL component is as we transition back to in building school, that our students need that, and our administration has been working very hard on that. But with this, with teachers teaching less classes, the students taking less classes, it made it a much easier transition. Also with this, they're not going to be using lockers, so they're going to be using backpacks, and it's just the less transitions make the biggest difference, and 75-minute classes.
And I think, as you both kind of touched on that, I think a lot of that feedback from the parents, when we went to those e-learning, that extended e-learning period after spring break, where we were doing one day was all 7 periods, the next day was an even day, the third day was an odd day. And it's some of those logistics and knowing which day is what and which teachers I have to log into and where I have to find this. I think was a lot of the feedback we received, and I think, in my opinion, the main reason that this will be so much smoother in the event that we have to close again. The kids can go on every day, same 4 periods, same 4 teachers, and we can log in, get our assignments done, move on with our day. So
the guidance counselors also should have already contacted all the students, because they're adding a class by doing this too for the semester.
Okay, well, I appreciate all you guys being here. Again, Wednesday morning, July 1st, right? That's the 1st. July 1st, 11 a.m. on the district Facebook page, facebook.com/Southern Hancock. The 4 of us will be back here again, and we'll be happy to take any questions you have. We'll put my email on the screen. You can send me any questions you have after you review the blueprint, and we'll plan on seeing you Monday. So thank you all for watching this video, and we look forward to a great 2020-2021 here at Southern Hancock.